everyone, I am Monica de Guzman from BSN 111C, a student nurse from Davao Doctors College. So for today, we'll be going to assess the cardiovascular of the patient. So the cardiovascular systems, your heart and your blood vessels, supplies your body organs in nutrients and oxygen so that your organ can do their jobs. So cardiovascular system, also sometimes called blood vascular or simply circulatory system. It consists your heart, which is the pumping device, and the closed system vessels, which are the arteries, veins, and capillaries. So the first thing that we must do is to review the client's previous medical record. Next is to determine the scope of the assessment, and I have here the materials needed, which are the stethoscope. For the measurements, we have the centimeter ruler and of course the cardboard and the pen light, which is the tangential light source. Alright, so without any further ado, let's get started. Hi sir, I am Monica de Guzman, your student nurse for today. So for verification, may I ask what is your name is?
Romeo Amper,
Alright, how about your birthday?
December 29, 2002,
Your age?
20.
Alright, so what language do you want me to speak?
English and Tagalog will do.
Alright, how about what do you want me to call you during this
Sir.
assessment?
Sir is 5.
Alright, thank you. So for today, I'm going to assess your cardiovascular system. I'm going to check your pulsations in your neck, in your arms, and in your legs. And I'm going to listen the sound of your heart. Would that be okay?
Okay.
Okay. So before we start, do you have any questions, clarifications regarding this assessment?
None.
Alright. So to ensure a privacy, I already closed the window and the door, so to give you a privacy and to make you more comfortable throughout our assessment. Would that be okay?
Absolutely.
Alright. So I'm just going to ask some questions regarding to your health history. Would that be okay?
Absolutely.
Okay. May I ask if you have any concerns right now? Do you have any pain in your chest?
Sometimes.
Okay, can you rate it, sir? 1 is the least, 10 is the most painful.
7.
Alright. Have you experienced shortness of breathing?
Sometimes.
Dizziness?
Sometimes.
Alright. How about headache?
Sometimes.
Do you have any history of hypertension?
None.
Or do you have any family history of coronary heart disease?
None.
Alright, that's great. So may I ask if you smoke, sir?
No.
How about, are you exposed to secondhand smoking?
No.
Alright. So, do you have any difficulties performing your daily activities?
Sometimes.
Alright. How about, do you exercise?
I do sometimes.
Alright, that's great. Now we're going to start our assessment with the jugular vein and the carotid arteries. So the first thing that we must do is to stand up at the right side of the patient, and we must position the patient into a supine position with the head of the bed elevated to 30 to 45 degrees, and to make sure that the head and the torso are plane. So the next thing that we must do is to instruct the client to turn his head slightly to the left being examined and shown tangential light source into the neck and the suprasternal notch, and of course the area of the clavicle to show any pulsations and shadow. Alright? If jugular vein jugular distension was noted, assess the jugular venous pressure by locating the highest visible point of distension of the internal jugular vein. Emphasize the distension with the tangential lighting. So for as deemed necessary, raise the lower head of the bed to 30 to 45 degrees until the highest visible point of distension of internal jugular vein was observed. Alright, so now we have to measure the distance in centimeters above the internal by exceeding. We're going to use the cardboard and the centimeter ruler. Alright. We have now we have to repeat that steps into the other side. So now we're going to the assessment of the carotid artery. So with the head of the bed still slightly elevated at 30 degrees, position the client's head slightly towards the side being examined. Alright, we have to palpate it to avoid any pressure while palpating the carotid arteries. Now we have to do it into the other side. Alright. So turn the client's head slightly to the side being examined. So we're going to put the bell of the stethoscope. We're going to auscultate the carotid arteries. Alright. Now we're going to start the assessment of the heart or precordium. I'm going to inspect and palpate. So the first thing that we must do is to general inspect the pulsations of my patients if there's any abnormalities in his pulsations. Well, I don't see any abnormalities. So right now, we're going to simultaneously inspect the precordium while for pulsations while palpating the aortic area, the pulmonic, and the tricuspid area. So now we're going to palpate the hips and lift using the palm or the fingertips flat obliquely against the chest. So Alright. Next is for thrills. Press the ball of the hand firmly of the chest to check for the buzzing or vibratory sensation caused by underlying turbulent flow. Alright, next we have to palpate the impulses using fingertips flatly or obliquely on the body's surface from the aortic area, pulmonic area, and tricuspid area. Alright, next we have to palpate the apical impulse using the palmar surface of 2 to 3 fingers. Then, for finer assessment, palpate with one finger alone to confirm characteristic of the apical impulse, noting for location, diameter, and amplitude. Okay, if unable to palpate the apical impulses with the patient's supine position, reposition the patients to roll partly onto the left lateral side. Palpate again using the palmar surface of several fingers. If still unable to palpate, ask the patient to exhale fully and stop breathing for a few seconds and palpate again while the patients maintain to partially facing left side. So, can you roll out to the left side? Can you hold your breath? Alright. So now, we have to inspect and palpate the epigastric area of the base of the sternum for abdominal aortic pulsation. Alright. Now, we're going to assess for heart rate and rhythm by placing the diaphragm of the stethoscope at the apex of and listening closely to the rate and rhythm of the apical impulses. So, we're going to use the diaphragm of the stethoscope first, and then the bell, auscultate the heart and all for anatomic side. Now, one is the aortic, second is the pulmonic, and third is the tricuspid, and the last one we have the apical area. So, now we're going to assess. Alright, we have to repeat the preceding step while patient in the lateral position, then sitting and leaning forward and briefly stop breathing after exhalation. So can you roll up to the lateral? Yes, that's right. Alright, can you sit down, sir? Can you breathe and then exhale and hold for a moment? Alright, thank you, sir. Now we're going to start our assessment on the peripheral vascular system. We're going to examine your lower and upper extremities. So we're going to assess each size, symmetry, temperature from fingertips to shoulder. So now we're going to note any presence of edema, lesions, or any textures of the hair and hair distribution. So now I'm going to inspect the peripheral veins in the arms, the presence and appearance of the superficial veins. Now, can I have your hand, sir? Alright. Just going to inspect if there's any lesions or edema. Alright. Temperature is normal. And now we're going to palpate for radial pulse, the brachial and the ulnar pulse. So, can I have your... Alright. Now we're going to assess for the capillary refill. So may I have your hand, sir? Okay, so your capillary refill are normal. So now we're going to perform the Allen test. So can I have your hands? Okay, can you squeeze it? Please squeeze it for me, sir. Then close. Then then. Alright, so next. Alright, close. now I'm going to examine your lower extremities. And I have it here. Now I'm going to assess and palpate the I'm going to what we call that one. Now we're going to examining your lower extremities at the supine position. Assess each leg for size, symmetry, skin color, temperature from groin to toes. Noted for any presence of lesions, changes in skin texture and hair distribution. So can I have your... Alright, I see that your hair is quite curly and I see some lesions. Alright, now we're going to palpate for femoral pulse, popliteal pulse, dorsalis pedis, and posterior tibials individually and bilaterally. Now we're going to start with your popliteal pulse. Alright, so next for your dorsalis pedis. And your posterior tibial. Alright, now we're going to perform the Homan's test. Alright, now we're going to the assess for the capillary refill for both legs and repeat the preceding step with the another leg. Now we're going to assess for your capillary refill. Alright, so I just wanted to tell that the prior for the performing the Homan's test, we have to while the client's foot firmly dorsiflexed, the interleg, we're going to support the interleg and extensions or had the client stand or walk. Okay, sir, we are now done with our assessment. So right now I'm just going to state the findings for the assessment that we had done. So upon auscultating your neck, sir, I've heard that there is no blowing sound. Pulses are equally strong, which is normal. So for upon the assessment of chest wall of your heart, chest movement were symmetrical, no retractions and no thrills. Pulsation are palpated in 3 areas. So for your heart rate, you have 75 beats per minute. And upon assessing your upper and lower extremities, so for your upper extremities, your arm size, symmetry, skin color, and texture, and as well as your temperature from fingertips to shoulder are normal. So your temperature is normal as well as your skin color. You have a light brown skin color, which is normal. So there is no presence of edema and lesions in your upper extremities. The hair is evenly distributed, even though it is quite curly, and your capillary refill is normal. So for your ulnar, radial, and brachial pulses, they are equally strong. So for performing the test Allen test, it is normal or good. So for your lower extremities, sir, your legs, symmetry, skin color, temperature from fingertips to your toes, um, it is all are normal. There is no presence. I've seen a lot. I've seen a present lesions. The hair is evenly distributed, like for your upper, which is quite curly, and so for your capillary fill, it is normal. The hair is evenly distributed, and no, there's no calves, there's no ulcerations, varicosities, as well as redness or swelling over the vein sites. Your pulsation palpated, which are the femoral pulses, popliteal pulse, dorsalis pedis, and posterior tibials. So these pulses have a normal rhythm. So that's all for our assessment for today. Thank you so much, sir, for your cooperation.
Thank you so much.